You're watching Action News 5 at midday.
In honor of Hispanic Heritage Month, Action News 5 is spotlighting individuals in the Hispanic community making a difference and inspiring others. Dr. Santiago Aguilar is the first and only Latin medical director in the entire Baptist Memorial Hospital system here in the Mid-South. He joined Action News 5's Amanda Hansen at the digital desk to share more about his story, which led him to serve the Mid-South.
Good morning. Amanda Hansen here at the Action News 5 digital desk. You know, it's Hispanic Heritage Month, and we've been doing all kinds of stories and spotlighting those in the community doing some really great, amazing things. And this morning, we have Dr. Santiago Aguilar, the first and only Latin medical director for the entire Baptist Memorial Hospital system in the Mid-South, joining us this morning to talk more about his story and the man himself right here on Zoom this morning. How you doing, Dr. Aguilar?
Good morning. I'm doing very good.
Well, we're excited to have you on with us today. And of course, I know a lot about you just from you became kind of a big face during the pandemic, especially helping to get information out to the community. I know La Prensa Latina has highlighted you as well. And of course, you are the medical director at the Baptist Memorial Hospital Health System. Talk about your role there and what you do.
I've been happily serving as the medical director for Baptist Medical Group since 2018 here in Baptist Memphis. Before that, I was working with Baptist Medical Group in Baptist DeSoto, but they opened the hospitalist group here in Baptist Memphis, and they brought me here to be the medical director. One of the challenges, of course, was to be the new group here in town. Facing with other groups and making sure we demonstrate our capacity to make the hospital metrics better. One of the also things that make me feel proud is that we grew up significantly. We started with 6 physicians, and now we are about 25 physicians in my group. And basically, we focus on making sure, patients are appropriately treated from the get-go, from the time they get to the hospital to the time they get discharged. Also, I'm very proud for the relationships that we have built up with other teams, with other subspecialty groups here in the hospital. And also, I'm very proud and very happy of the daily work we do to make sure our community is being treated correctly while they're here in the hospital, and assuring that when they leave the hospital, they don't have to come back.
Did you always want to be a doctor, or is this something that later down the line you said, you know what, I think this is... When did you know that this is what you wanted to do as a career?
I always had that inside of me, I believe. I mean, my dad is a veterinarian doctor. But so the science part was always on my family, but I always felt, leaning towards helping people and having that desire to understand more about the human beings and how to, make sure we treat diseases and make sure I can help my community to get better.
You can catch more interviews like this one weekday mornings on the Action News 5 digital desk starting at 8 o'clock on our streaming channel on actionnews5.com, also through our free news app and all of our digital platforms like Amazon Fire, Apple TV, and Roku.